For healthy living, a clean environment and proper hygiene practices are priceless. Perhaps the reason for the coinage that a healthy nation is a wealthy nation. Nigeria has had to deal with cholera outbreaks over the years and also intensified campaign for safe practices to protect citizens from infection as well as the need for vaccination. Yet the challenge persists, recording high fatalities across states of the country over time. On this edition, we move across Nigeria to understand the challenge of the recent outbreak across the nation, to identify some remote causes and efforts by state governments to contain the spread and the pain of cholera within communities. Thanks for tuning in to Dateline 360. I am Omotola Omojola. A UNICEF report indicates that about 30% of Nigeria's population lack access to safe water and 23% still practice open defecation. These are among factors that predispose communities to cholera. Uche Ugochukwu reports on the position of health experts on the recurring outbreak of the disease in the country and their position on prevention.
Records from the Nigeria Center for Disease Control show that in this year alone, more than 1,170 lives of ages 5 to 14 years have so far been lost to cholera outbreak in 23 states and the FCT.
Cholera starts like a very simple watery diarrhea, and very often it is taken for granted, but it kills you very rapidly because it disturbs the balance of fluids in the body.
The bacteria that causes the cholera is called Vibrio cholerae. It can be found in contaminated water sources and food sources. That's food that has not been washed very well or cooked very well. Then the signs and symptoms include abdominal cramping. That's when we say abdominal cramping, we mean pain in the abdomen.
Many rural areas and urban slums such as this community in the FCT practice open defecation and dumping of refuse close to the area's source of water.
Now, if somebody is infected and the person defecates in the open and there is no rainfall, the rainwater will just flush everything straight into the water source. All the people who drink from that source will have cholera. It's as simple as that. So we need to ensure that our toilets are not close to the water source, and even if at all, the toilet has to be downhill while the water source is uphill.
What a community should do, no matter how small, is maybe taking care of their drainages, washing the gutters, the toilet, and people who defecate on the open space. I think that should be discouraged.
With behavioral change on the part of the populace, proper nutrition, improved water and sanitation alongside other response measures like vaccination, people in communities such as these that are prone to cholera could be protected.
We have a committee that is going to start work very soon, comprising the Ministry of Health, Ministry of Water Resources, Ministry of Environment, Ministry of Family, Department of Family Health, and Ministry of Women Affairs to work together to start addressing this question of domestic hygiene, personal hygiene, community hygiene, and also, above all, the question of water.
UNICEF is supporting the federal government of Nigeria to develop what they call hand hygiene roadmap.
Health experts are optimistic that constant enlightenment and community-led approaches are critical in moving Nigeria up the ladder from second cholera most endemic country in Africa.
Uche Ugochukwu for Dateline 360.
Now, a number of states across the country have had to rise to contain the spread of cholera in Nigeria, and some are still dealing. In Plateau State, experts advocate the provision of potable drinking water, locals, personal hygiene and sensitization to contain the spread of cholera, particularly in rural communities where social amenities are inadequate.
Battling with a re-emerging health disease like cholera under COVID-19 upsurge, is a major tax that is gradually overstretching existing health facilities across the state. With 16 out of the 17 local government areas now infected by cholera, Bikan local government area is the only area without a case, is receiving attention against possible outbreak and spread of the disease.
We've recorded about 1,504 cases of cholera cases in Plateau State, and we've reported 33 deaths so far.
Key players are reaching out to affected communities with risk communication on personal hygiene, water and environmental sanitation.
Environmental health officers of recent, they have been so proactive. So we have asked them and we have directed them, which of course if you go out you see them. First of all, let them go to areas that the cholera is very prevalent.
Some residents in the affected areas say they are now better informed about the danger of cholera and promise not to throw caution to the wind.
Prevention is one, and which we used to tell our people and do some awareness about it.
I make sure that my environment is neat. Anything that I need to do, I shouldn't wait for the government to do it.
Looking at our environment, we have so many cases there. And what I would advise people to do is always make sure that their environment is very clean.
The popular slogan on the plateau since the outbreak of cholera is, "Cleanliness is next to godliness," as expert advises residents to cultivate healthy practices at all times. In Jos, Saadat Muhammad Kafa, reporting for Dateline 360.
Kebbi State is among the states affected by cholera recently. Usman Abdullahi Shehu reports that the disease associated with improper hygiene has spread to almost all the local government areas of the state and has sadly claimed many lives. To tame the scourge, the state government, he says, has embarked on a series of enlightenment campaigns at religious centers with traditional leaders at the forefront of the campaign.
The current resurgence of cholera in many states of the country is a worrisome public health crisis, especially coming amidst the emergence of the highly infectious, deadly COVID-19 Delta variant. In Kebbi State, the most vulnerable and affected areas are those who put less emphasis on personal and environmental hygiene. The disease is confirmed to have claimed over 200 lives in 20 of the 21 local government areas of the state, as recently announced by the state's health officials, and also over 2,208 suspected cases of the disease was recorded between January to August 2021, making it the worst case ever in the state. Hence the need for drastic measures to curtail the spread of the disease. These measures taken by the state government are intensive environmental sanitation and personal hygiene from the grassroots level, provision of water purifiers and drugs to cure the affected persons, as highlighted by the State Commissioner of Health, Jafar Muhammad.
Essentially, we want to reduce the mortality or eliminate the mortality caused by the cholera disease. Proper hygiene, that is by washing your hand with soap and water before eating, by washing your hand with soap and water after you defecate, to make sure that you are not transmitting the infection. We went around our 21 LGA. We are on the campaign to be able to disseminate information with regards to ways on how to prevent the spread.
State Epidemic Rapid Response Team identifies sanitation at the grassroots as critical in fighting the disease. Recently, Kebbi State government and the State Rapid Response Team came up with modalities to curtail the epidemic. Key in the prevention of cholera remain clean environment, proper personal and food hygiene, as the disease thrives in areas with contaminated drinking water, poor food hygiene, and filthy environments.
Delta State also has had a fair share of this public health concern. Ngozi Imokwede tells us how authorities in the state are putting up measures against the deadly disease.
The World Health Organization describes cholera as an acute diarrhea infection caused by eating food or drinking water contaminated with bacterium Vibrio cholerae, and it remains a global threat to public health.
People do not dispose of their feces very well, and the feces gets to pollute any nearby source of water that people go to drink. They are likely going to have it. The disease has been more or less seasonal.
Some of the conditions that can lead to outbreaks include a disruption in water supply, poor sanitation and hygiene. Infected people show symptoms within 2 to 5 days. The disease can be spread even when victims are not healed themselves.
Those of us who are in the public health sector need to do something, because we also need to report to the national office. When this happens, we require the actions of government and also members of the public, community, settlements, even the private sector coming into play.
In Delta State, 7 communities have been affected by the recent outbreak, although the government is creating awareness through the collaborations of the State Primary Healthcare Development Agency, Ministry of Water Resources, Health and Environment. Yet, some citizens do not see the need for a clean and hygienic environment.
We need to go back to the drawing board. If we can go to the rural areas to get their votes, we should be able to get to the rural areas to adequately prepare medical services for these people.
We should improve our personal hygiene. What we do after we've gone to toilet, we should be careful about the cleanliness of our environment.
All the representatives from the affected communities were invited, and other stakeholders, like the collaborating MDAs, they all gathered there and we sensitized everyone on how to control the situation.
This worrisome development demands an urgent action from the citizens and the government towards maintaining good sanitation and hygiene, access to clean water, campaign against open defecation across all the states. For Deadline 360, Ngozi Imokwede.
Now, the resurgence of cholera in 22 states of the Federation and the FCT, no doubt, is a public health challenge, especially at a time that the country also battles the coronavirus. Blessing Omeche Ebote has details of some of the strategies employed by the Benue State government to prevent an outbreak.
In the last couple of weeks, there have been reported cases of the disease in some states of the country, causing panic and concern for health authorities and residents. Benue State had in December 2020 to March 2021 witnessed an outbreak of cholera in 5 local government areas of Agatu, Obi, Gwe West, Guma and Makudi, with 924 persons infected and 54 deaths recorded.
We also had some suspicion in the IDP camp that is newly started in OTC along the road to Abuja. But when we investigated, we found out that it wasn't an outbreak because we had samples collected, taken to the lab, and they came out negative. We were still worried, so we've taken samples from the single source of water that the whole community takes from, and it's been sent to the lab, and we're expecting that they will tell us if there's anything close to that in the water collected.
The earlier outbreak prompted health authorities to employ aggressive risk communication strategies, engage traditional institutions and community-based organizations to sensitize the people in containing the situation.
You advise them to boil water before drinking. You advise them to cook their food properly before eating. They should not expose their food, because largely that is the cause of cholera.
Despite the awareness creation, some residents, especially those living along the banks of the River Benue, say their source of drinking water is directly from the river. This they do without any form of purification.
Though for we, it affects us because most of the time you discover people in this environment normally fall sick.
Open defecation and indiscriminate dumping of refuse have remained another major concern for authorities as residents still practice this with reckless abandon.
They use that the same water and still pour dirty inside the water and excrete inside the water. Yet they use the water and drink to cook.
Attitudinal change of residents, stakeholders believe is key to the prevention of cholera. In Makudi, Blessing Omeche Ebute, reporting for Deadline 360.
After 2 years of being cholera-free, Borno State again records significant cases of the disease. Pauline Kujevana reports that although containment measures have checked the cholera outbreak from reaching epidemic proportions, Borno State, bedeviled by insecurity, remains vulnerable due to the displacement of many communities.
Goza local government area is one of the 6 local governments affected by the cholera outbreak, recording close to 400 cases. With me is the vice chairman of the local government, Bitrus Adamu Zwarvi, who will tell us the current situation in the local government.
The rate of epidemic spread has been reduced drastically as a result of support given by the state government. Most of the patients were discharged home.
In a state faced by the peculiar challenge of insecurity, internally displaced persons camps and congested host communities are overwhelmed by poor sanitation and hygiene practices and other seasonal environmental factors leading to the cholera outbreak in the vulnerable communities.
Pulka is where that accommodates more than 2,000 or 3,000 IDPs lying there, and there is no proper toilet facilities for them. And by this rainy season, the water washes it, and that goes into the water they drink and whatsoever that causes the outbreak of cholera.
You know, some of our people are just coming out as a result of the insurgency. Some of the places were hard to reach, and now they've been displaced. They are back in various communities, and they were not immunized at that very time.
The disease, which was interrupted for 2 years due to the statewide oral cholera vaccination administered to people, in addition to rapid response mechanism put in place in 2018, has now resurfaced, putting government and partners to strategize for prevention and control of the spread.
What we did immediately was to send out our rapid response team to also join hands with those in the local government so that they can take care of this cholera outbreak.
Aside strengthening surveillance system in the affected communities, Disease Rapid Response Team, RRT, was activated in addition to fumigation exercise across the state.
We have identified all the places that was hit by the cholera, and we have accordingly sent our team to fumigate all these areas.
Other measures put in place in Borno State to contain and prevent the cholera epidemic include sustained desilting of drainages, clearance of refuse dumps, and environmental sanitation, in addition to scaling up of the WASH program statewide. Oral cholera vaccine, improved water and sanitation are deliberate strategies, if sustained, will check not only cholera, but other infectious diseases caused by contamination of environment. In Maiduguri, Pauline Kujevana reporting for Deadline 360.
And the Enugu State Ministry of Health, through its rapid response team, is leaving no stone unturned in containing further spread of cholera, which has claimed more than 19 lives and infected over 80 persons. Mina Okwabasi reports that other health partners in the state are not relenting to curb the spread.
The news of cholera outbreak in Enugu State on the 16th of July 2021, which infected more than 80 and claimed the lives of over 19 people, has put the state's Ministry of Health and its partners on their toes, attributing the cause majorly to poor hygiene practices and improper disposal of domestic and human waste, including high consumption of untreated water at the popular new artisan livestock market. Health experts say efforts are in top gear to achieve containment.
We're expanding capacity in those centers, getting more health workers to work there, and also providing the necessary infusions, the drips, and all the things we need to resuscitate them.
Already, 3 new emergency treatment centers have been established in the state to contain number of infected victims, while training of health workers has been activated to acquaint them of safety guidelines, which are also pasted strategically at the affected market to educate traders.
You know, say this market, some disease enter our market, and the people we are making business with them, and some people go out.
Though the federal government has activated the National Cholera Emergency Operations Center and rapid response teams deployed to support affected states, Enugu State is yet to receive the team as well as take delivery of the oral cholera vaccine.
We had alerted the National Primary Healthcare Development Agency and requested for oral drug for cholera for the state, which they have acknowledged, and they are working towards that.
Luckily, with the sustenance mechanism already in place in Enugu State, it is hoped that the outbreak will be permanently contained in the state. From Enugu, Mina Adobe Kobasi.
And back to Abuja, Onengie Fineface reports that the federal government has flagged off a national environmental sanitation response to cholera outbreak in Nigeria.
When food and water sources are exposed to dirty environments, the chances for people to contract diseases and infections are high.
Normally, they re-clean it morning, but before 30 minutes, you see the place is filled up with dirt again. It's filled up with dirt. When you are passing, urine will be smelling in your nose. You'll be hailing the odor of poo-poo.
Recently, cholera outbreak has affected several states of the country, including the FCT.
There's one man here from Mali. He died a few weeks ago. I learned that he was purging before he died.
And to contain further spread of the outbreak, the Federal Ministry of Environment is flagging off a national environmental sanitation response to cholera in Bazango, a community in Kubwa, which is an epicenter of the outbreak.
Environmental health officers in the states and local governments across the country have intensified their efforts in carrying out sanitary inspection of premises and abatement of nuisances that could result in cholera outbreak and other diseases.
As government has responsibility, we as citizens will also have responsibility to keep our environment clean.
Bazango community in Kubwa is the start point for this campaign, which will be taken to other communities and cities across the country.
Without education, people who don't know how to take control of the cholera.
The aim is to increase the consciousness of Nigerians to take responsibility in keeping the environment clean and to stop unhealthy practices like open defecation, indiscriminate disposal of waste, among others. In Abuja, Onengie Fineface.
It is expedient that we all take responsibility by ensuring that our environment is devoid of harmful lifestyles that expose our neighborhoods to cholera. It starts with me and you. Remember, a healthy nation is a wealthy nation. That's the program for today. Thanks for your time. May God bless Nigeria.